Hi, I'm Georgina Ruth Glorian from BSN 12. And for this video, I will demonstrate hand washing, bed making, transferring, and turning of patient.
I am Georgina Historian from BSN 11, and for this video, I will be demonstrating medical hand washing. First is to prepare and gather all the necessary materials: bar liquid soap, hand towel, and running water. Prepare and assess your hands. Trim your nails short and make sure to remove all your jewelries from the hands. Check the hands for any breaks or wounds in the skin. Then turn on the faucet and regulate water flow. Next, wash hands thoroughly by water. Hold hands lower than the elbow so that the water to the fingertips. Next is to apply soap to the hands. Rub your palms together and create a lather. Next is to rub the back of each hand with interlaced fingers. Then rub your hands together with interlaced fingers. Make sure to do this while singing Happy Birthday. Next is to rub the back of your fingers interlock. Then rub your thumbs, not just your thumbs but also your other fingers. Then rub the tips of your fingers. And rinse and dry your hands. Pat your hands thoroughly, from hands to arms. Then, use hand towel and turn off the faucet using also the hand towel. Now, for this video, I will demonstrate bed making, an occupied bed, open and close. So first is to perform medical hand washing or medical hand hygiene. Put on gloves if needed. So after that is to provide privacy. Next, assemble fresh linens. So one bottom sheet, one top sheet, and one pillowcase. And then place them on the bedside chair in order to use. Okay, so next is to put the bed in a flat position. Okay. After that, position the mattress up to the head of the bed. Then, place the folded bottom sheet with its center fold on the center of the mattress. And unfold the sheet full length with bottom hem at the bottom edge of the mattress and tuck in end of the near side. After that, meters upper corner of the bottom sheet. And then, tax the side of the bottom sheet working from head to foot. Then after that, place the top sheet half full length of bed with hem edge of head end of mattress. And then, unfold the top sheet and place it level with the top edge of the head of the mattress. So, na-unfold na natin. Next is to meter lower corner of top sheet and spread onto the near side, allowing it to hang free. Okay. And then, walks to the far side of bed, pulls bottom sheet tight, and tucks in head end of the bottom sheet. And then, meter top corner of the bottom sheet. After that, tuck in the remainder of the bottom sheet from head to foot. And then pulls top sheet and tucks under foot of the end of the mattress. Then meters lower corner of top sheet spreads and allowing it to hang free. So, ito na. So, gather open end of pillowcase length, grabs the closed end of the case and the center one hand and grabs pillow center edge with the same hand with free hand. Then fits pillow corners into case. And then, place the pillows at the head part with the open end of the case away from the doorway. So, since ito yung doorway natin, ang head ng pillowcase is naka-side dito, away from the doorway. After that, makes a cuff at the head part of the top sheet to make it an open bed. Ganito po for open bed. And then, draws the top sheet over the pillow to make a closed bed. So, ganito naman po. Closed bed. Okay, so next is to perform medical hand washing technique after the procedure. So, maintain proper body mechanics and doing these procedures. Then perform the procedure neatly. So that is all. Thank you. So for this video, I will demonstrate bed making occupied. So first is to check the client's chart and verify her current status, such as the presence of catheter and IV. After that, identify, greets the patient, and explain the procedure. So, good day ma'am, I am Nurse George po, and assign po ako sa pagpapalit po ng bed sheets niyo. Okay? Kayo po ba si Miss Angel?
Yes.
Okay. So, ayos na po ba na papalitan po natin yung bed sheets niya? Wow. After that, perform medical hand washing techniques or perform hand hygiene. Then, assembles fresh linens and place them on the bedside chair in order to be used. After that, put on some gloves. And then, provides clients privacy. So, assuming na meron tayong curtain here and ini-close na natin. After that, is to lock the wheels of the bed and adjust it. Assuming na nalock na natin, loosens the linens at the foot part of the bed. Here. And then, position client on one side of bed with side rail up and ensure client is covered. Then, inaasa natin yung rails. After that, loosens and rolls soiled bottom sheet until it reaches the client's back. So once there, tucks the sheets under the shoulders, midsection, and feet. And then, cleans and disinfects the mattress cover if needed. Ensure that it is dry. And then, unfold the unfolded clean bottom sheet close to the client's body. So assuming this is our fresh bottom sheets. Make sure na hindi tatama ang soiled bottom sheet sa fresh bottom sheet. After that, position client comfortably at the opposite side of the bed. So, then, nearest corner of the head part, tucks in under the mattress remainder of the bottom sheet from head to foot. That assist client roll towards her and informs that a bump can be felt in the middle of the mattress. So ma'am, meron po kayong mararamdaman na bump po rito sa likod nyo. Ito po yung fresh bottom sheets po natin, okay? Then after that, raise the side rail and move to the other side of the bed. Then here, lower side rails and reposition client comfortably to the other side of the bed. Lower, then stand sa tabi dito tayo, okay? Then, remove the soiled linen. Place the dirty linen into the correct receptacle. After that is to clean and disinfect the exposed mattress, ensuring that it is dry before moving into the next bed. And then after that, pulls the clean bottom sheet fully across the bed, ensuring that the sheet is smooth and wrinkle-free. So meters the corner of the head part and tucks in under the mattress the remainder of the bottom sheet from head to foot. So after that, turns the client to the center of the bed, then center the clean top sheet over the client. So instruct the client to hold the clean top sheet while removing the soiled top sheet from underneath. Then pulling gently from top to bottom. So place the soiled sheet in the hamper. Okay, so center natin tayo. Hold na lang po ito ha. Hold niya lang po ito. Yung bago. Okay, after that, folds down the top sheet to a level comfortable for the patient, and then takes the top edge of the top sheet and creates a cuff. And after that, replace the pillowcase, raise the bed rail. After that, replace the pillowcase, placing the old pillowcase in the appropriate receptacle. So, And after that, disposes all diamonds for workplaces policy. And then, while doing the procedure maintains proper body mechanics and next is to perform medical hand hygiene. Then performs the procedure neatly. So, that is all. Thank you. Okay, so for this video, we will demonstrate the transferring of the client from bed to chair. So first is to identify yourself, greet the patient, and explain what am I going to do. So, good morning ma'am, I am Nurse George po. So, ano po yung name niya? Kayo po si Miss Angel. So, ang gagawin po natin ngayon is transfer po kita from bed to chair. Okay lang po ba? So, next is to provide privacy by closing the door. Then, assuming na meron tayong curtains, and sinara na po natin ito. Next is to perform hand hygiene. After that is to assess the client's vital signs. So, yung blood pressure niya, yung pulse rate niya, respiratory system, temperature, and etc. So, assuming na in-assess na natin yon, next is to assess the client's ability to move and ambulate. So, ma'am, taas niyo po yung right and left hand niyo. Kabila po. Okay, yung isa naman ho. Yung paa niyo po. Pakitaas. Okay, kabila po. Okay, next is to assess kung meron po bang may pamamaga or sakit sa mga buto-buto. Okay, masakit po ba, ma'am? Kabila ho. Okay lang po. Ito po. So, also, i-assess na rin po natin yung muscles strength, especially sa lower extremities. Okay, after that is i-assess po natin yung medication na maaaring makapagpahilo or makapagpahina sa pasyente. So, meron po ba kayong ininom ngayong bago po itong oras na to? Meron ho? Ay, wala po. Okay. So, after that is to adjust the bed to the lowest position with the head part elevated. So, assuming na flat na tong bed na to, and then elevated na to. Okay, so next is to assist the client in assuming side-lying position facing the side where she will sit down. So here. Then, hawak kayo sa shoulders ko, hindi sa dito. Divided ko kayo sa face. Okay, after po nito is position the chair next to the bed. Here na po. Next is to lower down the side rails and stand with legs apart. After po nun, assist the client in swinging her legs over the side of the bed. So, ito yung paan. Pagbaba. And then, hawak po kayo sa shoulders ko, tapos this one. So, after nyan, assess the client's condition. So, meron po ba kayong pain na nararamdaman or discomfort? Wala. Next, put your feet shoulder and width apart, stand facing the client. So, ask the client to put one of her hands on my shoulder and the other on my wrist. So, nagawa na po natin yung kanina, yung ipinaupo po natin siya. So, next is to ask the client to slide her buttocks to the side of the bed until the feet touches the floor. So, okay po. Slide lang po natin, ipatanong po natin hanggang sumami natin yung door. Dito. So, after that, at the count of 3, help the client rise to a standing position. So, at the count of 3 po, tatayo po tayo. Ayos lang po. Okay, 1, 2, 3. And then, ask the client to put her arms on the arm of the chair. To steady her while I am slowly lowering the client to a sitting position on the chair. Ayan. So, lagay niyo po yung kamay niyo dyan sa chair niyo. Then, adjust the client body alignment. And then, lastly is to perform hand hygiene and document pertinent observation. Okay, so for this video, I will demonstrate on how to assist a patient with turning in bed. So first is to identify the client and explain the procedure. So, good day ma'am, I am Nurse George po, and kayo po ba si Miss Angel?
Yes.
Okay, so ang gagawin po natin ngayon is ito-turn po natin sa kabilang side yung paghiga nyo, okay? So, since ngayon po is sa left kayo, ngayon po sa right side na po kayo haharap, okay? So, next is to provide privacy by closing doors and curtains. So, assuming na meron tayong cortina rito at isinara na natin. Third is to perform hand washing or hand hygiene. Next is to adjust the bed to a flat position and a comfortable working height. So, assuming na flat na ito. Okay. Next is to remove and place pillows and other supportive devices within easy reach. Now, tatanggalin na po natin. After that is to move the client to the edge of the bed opposite to the side where the client will be turned with the use of the drawstring. So, okay. After that, raise the side of the rail and transfer to the opposite side. So, assuming na na-raise na natin yung rail. So, lower the side rail nearest to you. So, bababa na ito. Okay, next is to prepare the client by putting her arms across her chest and her foreleg over the leg nearest to you. Okay, after that is to stand at the center of the bed, place your hands in the client's shoulder and hip and roll the client towards you. After that is to place a pillow behind the client's back for support. Okay. And then, put the shoulder blade forward and out from under the client. 2, 3. After that, put the client in a comfortable position by placing the pillows under the leg as needed. And then, raise the side rails and make sure the client is in a good body alignment. After that, perform medical hand hygiene techniques and document procedure.